treatment? So my answer usually is at an early stage where the cartilage layer is not that degenerated, it is still there, and at an early stage we can cure it with multiple treatment modalities like intra-articular viscosupplement injection, some cartilage building medicines. With the help of exercises and physiotherapeutic modalities, we can control it to an extent. But when it reaches a severe stage, then there is no other treatment modality other than knee replacement. However, at an early stage where only medial joint is involved, then we can go for partial knee replacement. But when both the condyles are involved, both the compartments are involved, then we have to opt for total knee replacement.